If you regularly wake up with painful, stiff, swollen, or aching hands in the morning, you're definitely not alone. Hand pain is one of the most common symptoms we see in rheumatology, and many people are unsure what it actually means. Some people assume it's simply aging or overuse, while others worry it could be arthritis or autoimmune disease. In reality, there are several possible causes of hand pain in the morning, and understanding the pattern of symptoms can provide very important clues. In this video, I'm going to explain the common causes of morning hand pain, the difference between inflammatory and mechanical problems, when symptoms may suggest arthritis, and when you should consider seeking medical advice. I'm Dr. Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology London. Let's start with one of the most important questions in rheumatology. How long does the stiffness last? This is because the duration and pattern of stiffness can tell us a great deal about the underlying cause. Mild stiffness for a few minutes after waking up is extremely common and not necessarily concerning. However, prolonged morning stiffness lasting more than 30 to 60 minutes raises concern for inflammation. Patients with inflammatory arthritis often describe waking up with the hands that feel swollen, tight, heavy, or difficult to move. Many struggle to make a fist grip objects or open jars first thing in the morning. Now, one of the most important causes of morning hand pain is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where the immune system mistakenly attacks the lining of the joints. This leads to inflammation, stiffness, pain, and swelling. The small joints of the hands and wrists are commonly affected. Patients often notice symptoms affecting both hands symmetrically. For example, both wrists or both sets of knuckles may feel painful and stiff. Morning stiffness is often one of the earliest symptoms. Patients frequently describe their hands gradually loosening as they start moving around during the morning. Another important clue is swelling. Patients may notice puffiness around the knuckles or fingers. Rings may feel tighter. Some people notice warmth or tenderness around the joints as well. Fatigue is also extremely common in inflammatory arthritis. Many patients feel exhausted alongside the joint symptoms. This type of fatigue is often very different from normal tiredness. Now, another common cause of hand pain is osteoarthritis. Osteoarthritis is different from rheumatoid arthritis. Osteoarthritis occurs when cartilage gradually wears down within the joints over time. It is more related to wear and tear, aging, previous injury, and joint degeneration rather than autoimmune inflammation. Osteoarthritis commonly affects the finger joints, particularly near the fingertips and thumb base. Patients may notice bony enlargement of joints over time. Stiffness does occur in osteoarthritis, but it is usually shorter lasting compared with inflammatory arthritis. Activity later in the day may actually worsen symptoms because the joints become more irritated with use. Now, tendon problems can also cause morning hand pain and stiffness. Conditions such as trigger finger occur when tendons become irritated and swollen. Patients may notice fingers catching, clicking, or locking. Symptoms are often worse in the morning because the tendons stiffen overnight. Tendon inflammation can also occur in inflammatory arthritis and psoriatic arthritis. Carpal tunnel syndrome is another extremely common cause of hand symptoms. This occurs when the median nerve becomes compressed at the wrist. Patients often wake up with numbness, tingling, burning, or pain affecting the thumb, index finger, middle finger, and part of the ring finger. Symptoms are frequently worse at night or first thing in the morning. Some people shake their hands to relieve the symptoms temporarily. Carpal tunnel syndrome may occur on its own, but it can also be associated with inflammatory arthritis and other medical conditions. Now, another important condition is psoriatic arthritis. Patients with psoriasis can sometimes develop inflammation affecting the joints, tendons, and fingers. Some people develop swelling affecting entire fingers, often described as sausage digits or dactylitis. Morning stiffness is common in psoriatic arthritis as well. Importantly, some patients develop joint symptoms before obvious skin psoriasis is diagnosed. Now, another thing patients often ask is whether hand pain always means arthritis. The answer is no. Hand pain can also result from overuse, repetitive strain, tendon problems, nerve irritation, injury, or mechanical stress. However, the pattern of symptoms matters enormously. Inflammatory arthritis tends to cause prolonged morning stiffness that improves with movement, whereas mechanical problems often worsen with activity later in the day. Another important point is age. Mild stiffness and osteoarthritis become more common as we age. However, inflammatory arthritis can affect adults of all ages, including younger people. I regularly see patients in their 20s, 30s, and 40s with inflammatory arthritis, so younger age does not exclude the possibility of autoimmune disease. Now, another common question is whether blood tests can diagnose arthritis. Blood tests can sometimes help identify inflammation or autoimmune markers such as rheumatoid factor or anti-CCP antibodies. However, blood tests are not perfect. Some patients with inflammatory arthritis can still have normal blood tests, particularly early on. This is why diagnosis is based on the overall clinical picture rather than blood tests alone. Ultrasound or MRI scans may sometimes detect inflammation not visible on standard blood tests or x-rays. Now let's talk about when you should seek medical advice. It's worth seeking assessment if hand pain or stiffness is persistent, particularly if stiffness lasts longer than 30 to 60 minutes in the morning, if swelling is present, if multiple joints are affected, or if symptoms are interfering with daily activities. Fatigue, psoriasis, inflammatory back pain, Raynaud's phenomenon, or other autoimmune features may also increase concern for inflammatory disease. Another important thing I always emphasize is that early diagnosis matters. Untreated inflammatory arthritis can potentially lead to joint damage over time. The good news is that treatments today are far better than they used to be. Early treatment can significantly improve symptoms, quality of life, and long-term outcomes. Now, many patients also ask whether exercise helps. In inflammatory arthritis, gentle movement and exercise often improve stiffness. Keeping joints mobile is important. Hand exercises, physiotherapy, stretching, and maintaining activity can all be helpful depending on the underlying cause. Completely avoiding movement often makes stiffness worse. Now let's summarize the key messages. Waking up with hand pain or stiffness is extremely common, but the pattern of symptoms matters. Brief stiffness lasting only a few minutes may occur normally or with osteoarthritis. However, prolonged morning stiffness, swelling, fatigue, or symptoms affecting both hands raise concern for inflammatory arthritis such as rheumatoid arthritis or psoriatic arthritis. Tendon problems, trigger finger, and carpal tunnel syndrome are also important causes of hand symptoms. Blood tests can sometimes help but may occasionally remain normal despite inflammatory disease. Most importantly, persistent symptoms should not simply be ignored. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.